Wow. Okay, good afternoon, everyone. Good afternoon, and welcome to today's episode of Becca Health Foundation Health Talks. I'm super excited. I'm super excited to be in your midst today, and I'm super excited to be bringing you this befitting and sensational topic. Yeah, I'm so excited. Now, I welcome you today. Happy Sunday. I hope we all went to church and we all had a blessed day. So, today I'll be talking about a very sensational topic. Like I always do, I like to introduce myself and what the foundation is all about. So, I'm your host and presenter, Nurse Anane, a registered nurse and also the brain behind Becca Health Foundation. Now, what's Becca Health Foundation all about? Becca Health Foundation is all about caring and giving health information and health promotion tips to our nursing mothers, our breastfeeding mothers, and our pregnant mothers. Both, though sometimes we try to bring in other group of people like the general public, giving them a general health topic. But most of the time, we like to talk to our nursing mothers, our pregnant mothers, and our lactating mothers to make sure we take care of them because we are more concerned about our neonates and our young ones. We are more concerned about our maternal health and our neonatal health. So that is what Becca Health Foundation is all about. We come on here every Sunday to give live talks. We also have our YouTube channel. If you're not able to meet up for our live talks, you can go to our YouTube channel, subscribe, watch the videos, and also ask your friends to do the same. Or you join in our live videos, or most of the times we'll go to our primary healthcare centers to give health talks to our pregnant mothers and also health educate them on what they're supposed to know and what they're not supposed to do, how they're supposed to take care of the young ones, how they're supposed to take care of the newborn babes, and what they're supposed to eat to take care of them, and what they're supposed to feed them with and what they're not supposed to feed them with. So generally that is what we do in a nutshell. That's in a nutshell. So today, like I said earlier, I'm very super excited. So today I'll be bringing a very sensational topic, but this is mainly for my nursing mothers today. Sorry, my pregnant mothers can actually learn a thing or two about it. They can also learn from it. Yes, because it's for both sides. More on the nursing mother side and less on the pregnant mother side. But you can also take this tip as a pregnant woman. You can also take this tip and use it when you actually give birth to your young one. So what are we talking about today? Drum roll. Today we'll be talking about breastfeeding. Yes. We'll be like, breastfeeding is a general topic. Yes, it's a general topic, but how much do you know about your breast milk? You, that nursing mother that just gave birth a few days ago, how much do you know about your breast milk? Do you know the importance of breast milk? Do you know the kind of nutrients that are contained in it? Do you know the health benefits and health implications it has on a child? Or do you know how rich it is in some nutrients and low it is in some nutrients? What are the things you know about it? We're going to talk about it here live on this Facebook. So while we wait for others to join in, let us just take a stroll. Now we're going to take a stroll that is glide through breastfeeding initially. We'll talk about breastfeeding. We'll talk about how the milk is formed, the part of the body that the breast can be located on. Yes, it's not everybody that knows where breast is. Sorry, that is in quotes. Like, it's not everybody that knows where breast milk is being formed from. So we're going to take a glide through, talk about a little things, because I would like to say something before I go into this topic for today. I'm going to use 3 weeks to treat this topic because it's actually very, very sensational, and I'm very particular about it because a lot of my patients, my mothers, they are like, they don't even know the importance of breast milk. When they come to me and they search for advice, they are always like, is it compulsory I have to feed my baby exclusively for 6 months? I'll talk about exclusive breastfeeding also as we go along the line. So today I might not be talking much about it today, but I would actually scratch the surface and give us a little in-depth of what breastfeeding is actually all about. Then subsequently, in the subsequent weeks, I'm going to talk more about it. So first and foremost, what is breastfeeding? Yes, a lot of us think, okay, breastfeeding is the process of feeding a baby with milk, breast milk that is being expressed from the breast, either expressed or direct breastfeeding. Now, what do I mean by express or direct? Now, expressed in the sense that you actually have to pump out the milk from your breast by pressing or by using this breast pump. You pump it out and then you feed your baby with either a cup and a spoon from the expressed breast milk. That is, you've expressed it, you've pressed it out from your breast into a cup. Then you feed your baby with a spoon. And then the other one, I said, by direct breastfeeding, this is the process of allowing the baby to feed directly from the breast. You're positioning the baby on your breast. The baby's mouth is attached to the areola of your breast. That is the black area of your breast. And the nipples are inside the baby's mouth. And the mouth is totally lashed on the areola. And the baby sucks it out. That is direct breastfeeding. So I will talk about breastfeeding now. So breastfeeding is the process of feeding the baby, like I explained earlier, of feeding the baby with breast milk. Now, breast milk contains a lot of compositions and properties. A lot of us don't know that our breast milk has enough fat content. It has carbohydrate content. It has vitamins and minerals. And before I forget, the most important one, it has antibodies. You know, I talked about antibodies when I was talking about rest source antigen. Someone who has been following up on our videos will remember very well. I talked about antibodies and antigens, where I said antibodies are like soldiers that helps to fight infection in the body, and they are being created by our blood cells. So if we are not so conversant with what our breast milk contains, you will not even be able to take up that courage to say, I want to feed my baby exclusively for 6 months. Because World Health Organization they've made this law that you have to feed a baby for 6 months. Why? It's because the most important reason is just because of these antibodies that is contained in the breast milk. It helps the baby to fight against a lot of infections that might want to come into the baby's body, either through the baby's feeding or the baby's survival, because it's not all women that are neat. I'm sorry to say that it's not all women that are. Normally, before you feed your baby, you're supposed to clean your nipples and your areola very well. Clean it with warm water. You clean very well to avoid dirt before allowing your baby to feed directly on it. While some people just use their hand to just do something like this. They'll use their hand to do something like this, and then that's the end. They don't clean it well. So a lot of this infection, the baby takes it, and when the baby doesn't have a strong immunity to fight against this infection, you see the baby coming down with different kind of diseases. So we always tell mothers, this your breast milk contains a lot of antibodies, a lot of lysozymes. Lysozymes are important for the baby. Please let us all learn to feed our baby with breast milk exclusively for 6 months. So those are the components, and I will try to say some points. Now, the components and properties of breast milk are depending on 3 points: the time of the day of the feeding, the nutritional content, that is the maternal nutritional content, what the mother eats, the amount that is being given to the baby, the amount of breast milk that is being given to the baby. So these points are important. Like in the morning now, when a mother wants to breastfeed a baby in the morning, the content and the fat content is more higher in the morning. So if you think you want your baby to have enough fat content in the body, enough fat to be able to produce brown fat that will prevent cold, that will be able to protect the body from cold and adverse weather reactions, you make sure you breastfeed your baby early in the morning, because the fat contents are more in the morning while they are lesser in the evening. Now, on the maternal nutritional aspect, whatever the mother eats does not affect the fat content or the properties of the fat in the breast milk, but it affects other nutrients such as the carbohydrates and the vitamins level. Now, there are some mothers that take pride in eating a lot of bread, and you know your baby is only taking breast milk. Please reduce it. Reduce it. Thank you, Dokun, for joining in. Please reduce it, because a lot of us don't know that the content of the carbohydrate you taking is actually affecting your baby. The baby sucks everything from the breast milk, everything from the breast. The baby takes in everything from the breast. So you not being able to control the kind of things you eat, though it does not affect the fat content of the body of the breast milk, because the fat contents are there initially. But when you are not able to control the number of carbohydrates, like a lot of mothers will take in bread and then they will now complain that my baby is having constipation or my baby cannot poo well. What did you eat? It does not affect the fat content initially, fine, we know that, but it affects other nutrients that are found in the body, such as the carbohydrate level and the vitamins level. That's why it's always advised that even when you're breastfeeding, there are some drugs that are always not advised for a lactating mother to give to her baby. And what do I mean by lactating mother? A mother that is still in the breastfeeding period. You're still breastfeeding your baby is sucking, and the baby is not even taking anything, maybe complementary foods or supplementary foods, not taking any other thing apart from breast milk. That's a lactating mother. Now I would like to talk about the types of milk, breast milk, we have, because a lot of us don't know that we have different types of milk. Yes, we do have different types of breast milk. We have the colostrum, we have the transitional milk, and we have the matured milk. Those are the three types of breast milk that we have. Now the colostrum, like they say, when a woman gives birth, your midwife will always advise you, please breastfeed the baby. After they've showed you the sex of the baby and they've showed you what your baby looks like, they've told you what your baby looks like, and you've seen the sex of your baby, after cleaning up the baby, they will ask you to breastfeed after you're being cleaned up. Even when you are cleaning you up, they will want your baby to be put to breast. That is the best way to protect that baby from infection, because that first milk that is going to come out from your breast is colostrum, and it contains a lot of lysozymes, as I mentioned earlier, a lot of lysozymes, a lot of antibodies, a lot of fatty content that can protect that baby. Now there are some others that will say, because I just gave birth, I'm weak, I cannot breastfeed. You don't need to do anything. All you just need to do, just attach the baby to the breast. You can lie down in any position you want. It is always advisable that after a few hours of delivery, the baby is put to breast. The baby is put to breast after a few hours of delivery. It actually protects the baby, increases the fat content, thereby protecting the baby from adverse weather condition, and also increases the number of antibodies in that baby. So it's always advisable, because that first milk that is being produced at that stage after postpartum, that is after delivery, is called colostrum. It's always bluish in nature because it contains a lot of fluid and a lot of other vitamins and minerals. So it's always important as a mother you put your baby to breast after delivery. Now we'll go to the transitional milk. Now the transitional milk is, now before I go to transitional milk, I would like to give a very little point on colostrum. Now colostrum does not run only for the first day after delivery. It can actually still be coming out for the first 2 to 3 days. Now a woman gives birth today, the colostrum will still run for like 2-3 days more before it changes into transitional milk. And the transitional milk it starts coming out after a few days after the colostrum has actually been sucked by the baby. And transitional milk is more creamier and also contains nutrients and antibodies, but it's not as, the antibodies in it are at a reduced level. Let me put it that way. I'm trying to use a layman language. The antibodies are at a reduced level. They are not as much as the colostrum content, the antibodies in the colostrum content, but the transitional milk is still creamy. You'll see it, if you see the content of the milk is very creamy and thick somehow, because the colostrum, which is blue, whitish blue in nature and watery, has already been exhausted. Now a thick fluid is the one that's actually coming out from the breast milk. So that's the transitional milk after few days after postpartum. Then we have the matured milk, which comes later on, maybe 24 days after, 48 days after delivery. That is when we find the matured milk. That one is more creamier than the transitional milk, and it's actually richer in other nutrients but less in antibodies. Now, do you understand that? Can you weigh the difference? Now, the colostrum has the highest number of antibodies and less nutrients, but it has enough fat content. The transitional milk does not contain enough antibodies, so it has some antibodies, a little of fat content, and more of vitamins and minerals. Now in the matured milk, we don't have antibodies in it, but we have the fat content and other nutrients that are needed by the child. So that is the difference between the 3 types of milk. Now I will talk about the milk letdown. A lot of us think that, okay, if my baby does not suck, I cannot produce milk. Fine. We all understand the fact that the milk letdown reflex can only be welcomed when there's an attachment of the mouth of the baby to the breast. And what I mean by the breast, I don't mean the whole breast, I mean the areola. Now a lot of us don't know where they are. Fine, I cannot show you my breast though, but I will explain. So I would like to even give an image. I will drop the image in our YouTube channel. So if you really want to look at the image of how the breast is being made, or how the breast looks like, you go to our YouTube channel, subscribe, and you see the image under the video. Now this areola is black in nature and it's at the tip of the breast, after the nipple, or should I say before the nipple. Yeah. So the baby's mouth has to attach to the areola. When the baby's mouth attaches to the areola, it sends a signal to the brain of the mother that this is what I need. Then oxytocin is being produced. When oxytocin is being released, it enhances the brain signals to actually pump in the breast milk into the breast. You see, the nerves and everything that are connected in the breast, they send signal to each other like, okay, this is what is needed at this special point in time. At that time that milk is coming out of that breast, there's actually a contraction and a relaxation of the woman's womb. That is why there are some women that after delivery and they are breastfeeding, they will always cring in pain. When I make cring, they will try to bend down a little because they are always feeling pain at the lower part of their abdomen. Because as that signal and sensation is being sent to the brain for the milk to be let down, for the milk to be produced, the womb is also being affected by the oxytocin that is being released. So it's always occurred that they go hand in hand. And when there's a relaxation, that is, the milk has already been produced, and then the baby sucks the breast milk from the breast. That is how milk letdown occurs. Now I'm not going to talk about more about milk letdown today, but I will have other things to talk about next week. So today we will still have a little to talk about. Maybe by next week we'll say more about breastfeeding. But for today, let's just leave it at this point where I said that there are 3 types of milk. Don't let us forget. We have the colostrum, we have the transitional milk, and we have the matured milk. And also, I said there are 3 factors that are important in the components and properties of a breast milk for you to have a good and quality breast milk to be able to feed your baby with. So don't forget, we have the time of the day. And like I said, fat content is more in the morning than in the evening. Then the type of nutrition the mother takes, that is whatever the mother eats, it does not affect the fat content of the breast milk, but it affects other vitamins and other nutrients that are needed by the baby, such as your carbohydrates. That's why it's not advisable that as a mother you take too much of bread. It causes constipation in the baby because baby will suck it. Now, another thing is, I talked about the maternal weight of the mother. It does not affect the breast milk. And I also talk about the components. What are the components of breast milk? I spoke about the lysozymes, I spoke about the antibodies, I spoke about the fat content, and I spoke about the other nutrients such as carbohydrates and vitamins. So let me just leave you today with this short one so that I don't confuse us all. But don't worry, I'm going to drop a full video on our YouTube channel, and you can also join us next week so that you can have a good understanding of what the benefits of breastfeeding is. Yes. So next week I'll be talking about the benefits, the health implications, the health malpractices, the bad feeding practices a lot of us practice. Yes, there are some mothers that don't know how to do breastfeed. They don't know how to attach the baby well to the breast, and they find it difficult to attach. So next week I'll be bringing in a lot of videos, a lot of pictures to give us. We have the kangaroo feeding, we have every other types of feeding you can take as a mother. We have a lot of relaxation techniques you can use to feed your baby, and you won't have backache, and the baby too would not suffer loss. You and both your baby, you are comfortable and you are enjoying yourselves. So we'll be talking about that next week, and also the health implications about breastfeeding. So please make it a date with us, and don't forget to join us same time, same place next week. I remain your humble host, Nurse Anane, and I hope you all all have a wonderful evening. And don't forget to subscribe to our YouTube channel. I'm going to drop the link after this video. Just try to subscribe to our YouTube channel. You can also watch other videos. If you know you are not benefiting from this breastfeeding topic, we have other videos you can actually watch and listen to. And don't forget to give us a thumbs up, a thumbs down. We need those critics. We need to know where we are missing it and where we need to improve. All those things are very, very important. And don't forget to invite your friends. Like I said, my YouTube channel is for pregnant mothers, nursing mothers. Please bring them, let them come and learn. This is for them. All right, thank you for joining me today. God bless us all. Have a wonderful week. Thank you. Cha-cha.